what can the family, friends, and family members do with that person? What is supposed to be their behavior, or how should they act around
Right,
them?
right. First thing, let's talk about the do's, and then there are 2 to 3 don'ts that we can talk of. First thing that you do is proactively ask. Tell them that we are there for you, and even if you don't feel like speaking at this moment, we are there for you 24/7. Whenever you feel that you want to talk about something, we are there for you. Second thing, try to be as non-judgmental as possible. Now, you can't become a professional because you're emotionally invested into the family member or the friend, but try to be as non-judgmental as possible. Once he says something that I am not feeling positive, or I feel that the world should end, or I feel that I should not exist anymore, do not react there and there itself. Why are you talking like this? What makes you say this? Your entire world loves you. Your family loves you. You are increasing that person's guilt by saying so. Because when you tell him this, he feels, already he has a lot of guilt that he doesn't know from where it's coming. And then he starts feeling more guilty, that I have let down my family also. So be as non-judgmental as possible. Third thing, what you need to do is support him and seek the help of a mental health professional, a psychiatrist or a psychologist. Fourth thing that you need to do is try and make conversations around it as as healthy as possible. Do not make it some kind of a taboo subject. Let's say somebody in our family is suffering from diabetes. We don't close the doors of our house and then we say, oh my God, my mother is having diabetes. Please don't tell anybody. So the day we reach a place wherein everybody is able to talk about mental health issues on the dining table, I think more people will come out. What you don't need to do is tell them, think positive. Try and listen to motivational speeches, listen to motivational videos on YouTube. If that had been the treatment for depression, then it's a very easy thing that whenever you feel depressed, you just want to watch a motivational video. And if you're feeling good after watching a motivational video, it was not depression in the first place. It was boredom. It was stagnancy. Depression is a medical problem. It's not something, everybody faces a little bit of boredom these days. We say that we are feeling depressed, but what we are feeling is we are feeling a little down on that particular day. There a motivational video will really help you. But but when you're depressed, it might not help you that much. What needs to be done is, I'll give a common analogy. Let's say many people also say, you do yoga, you do meditation and the depression will go off. Yes, these are wonderful things as an add-on to the basic treatment of depression. But like, let's say when we are eating our meal every day, we have chapati, we have dal, we have rice, which compromises the main meal. And then we have got some pickle, or then we have got some buttermilk, which adds flavor to the food that we are eating. Similarly, therapy, medicines, if required, severe forms of treatment, which the psychiatrists like ECT can be given. These are the mainstay of depression treatment. These are like the bread and butter. These are like the main part of your meal. And on top of that, yoga aap karo, very nice. You do meditation, very nice. You talk to your family members who listen to you, very nice. This will act like the pickle. This will act like the icing on the cake, but they can never become the cake. They can never become your main meal. If you make that mistake, the likelihood is that you will increase that person's depression. You're trying to help with a very good intention, but because your knowledge is not correct, you are giving wrong advice. It's like what needs to be done is, even if family members are able to identify that this is a problem and take him to or her to a mental health professional, I think that is in itself a very big thing. You yourselves can't become psychiatrists. It's like somebody is having a heart pain. So what is taught these days to general public is, somebody is having a heart attack, you need to know the ABC of how to do resuscitation, how do you preserve the life. You don't teach them to become a cardiologist, or you don't tell them to give expert advice. Okay, now this is the problem, this is what you need to do. At most, what you can do is, you can tell them, if somebody is having a heart problem, this seems to be a severe heart problem. I need to know, if there is an emergency, how do I save your life in the given possible circumstances, but you need to go to the cardiologist. You don't become the cardiologist. Similarly, don't think that just yoga, meditation, writing a journal, talking to a friend, these are additive things. These are like the pickle to our dinner or our lunch. You can't just eat pickle for dinner. That's not going to work. That needs to be remembered.
Right. So, at what point, is it right for a person to take professional help? Because, like you said, sometimes you may just be feeling low, or there may be continuous, days where you feel a little low or you feel a little upset. But by watching something or by looking at something, temporarily you become okay. But after that,
Right.
again, maybe you feel low.
Right.
Or so,
Right.
at what point does
Right.
one identify, when should they go to
Right.
the mental health
Right.
professional?
Right. Right. See, I'll tell you a very interesting concept. In some countries, some European countries, everybody, each and every person has their own therapist. So even if you're not having a mental health issue, you just go to them once a month and you talk about how your month has been. Now that I think might be wishful thinking if I think that it will happen in India in the next few years. But that should be the ideal. Let's say 20 years from now, we should keep that to be the ideal. That like everybody has their nearby kirana shop, like everybody has their nearby medical shop, like everybody has their general physician. Now you have a family doctor. Everybody should have their own psychiatrist. You go to him once every 6 months, even if you're not having an issue. Coming to the scenario wherein you're not comfortable with that, just you'll say, doctor, all of that is all good, but the country that we live in, the situation that we live in, is still so much of a taboo. So when do I go? First, as far as depression, you said, if you feel that lack of happiness or that boredom persistently for 2 weeks, then we say that you're having a major depressive episode. You must go to someone. Two, if you're feeling low throughout, you're feeling anxious throughout, you interact with people and then you become alone, again you start feeling bad, you need to go to someone. Third thing is, if you get even one suicidal thought, even once every month, and that stays only for 5 minutes, but if you get a suicidal thought, please go and seek help of a psychiatrist, because you don't know when that suicidal thought, which is once a month right now, will become once every hour. We don't want it to progress to that level. Because the key is, let's say, the earlier you go to the mental health professional, the earlier he will treat you. It's like, let's say, and many people, again, I'll give the heart example. Many people say that if you are having a heart attack, you need to reach the hospital within the first 90 golden minutes. If you reach within 90 minutes, that's why ambulances are given green corridors. If you reach within 90 minutes, the chances of saving the patients are very high because damage has not been done. Similarly, if you visit the psychiatrist within the first 1 month of you having issues, any minor issues, even if he gives only therapy, even if he gives very mild medication, the chances that the brain damage is less and therefore the duration of your medication is less are much higher. The later you go thinking ये तो निकल जाएगा, ये तो समय है बीत जाएगा, कभी खुशी कभी गम, this phase will go off. The more you think that way, the more you are increasing your problem, the more you are going into, it's like a Chakravyuh and you are like Abhimanyu and you are getting more and more stuck in.
A lot of people also think that once they take medication for a mental health illness, they may have to take it for the rest of their life. So they try to ward off that by doing different things like you mentioned, trying to look at some motivational video or trying to do yoga and try to ensure that they get away from professional help so that they don't have to take medical they don't have to take medicines throughout their life. So what is your perspective on that? How do you?
Yeah, it's a very, very common problem. Very rightly you've put it. It's like if I get 100 patients, 50 patients are more concerned in their first visit. They don't ask me, doctor, will I become good or not? They'll ask me till when do I have to take this medication? So there is a lot of I would say irrational fear regarding this. Now there are two categories of mental health issues. One is we say minor mental health issues. Then is major mental health issues. Let's talk about the major mental health issues. There are only 2 to 3 illnesses which fall into this category. First is schizophrenia. It is like the worst mental health issue anybody could have. Second is bipolar disorder, sometimes very severe OCD. These problems, if OCD if it is severe, these problems might, again I'm saying might, require lifelong medications. But the more common problems which 95% of the population faces, like sleep issues, anxiety issues, phobia, adjustment issues, depression, these problems generally you require to do a course of medications of 6 to 9 months. Many people, even in this, they feel that they start feeling better in 2 to 3 months of medication, and then they stop the pills. It is wrong. If you do a 6 to 9 month course, and during that 6 to 9 month course, if you do some sort of therapy, now here is the catch point. Many people, what they do is they start taking medicines, they start feeling better. So they just become dependent on medicines. They don't do anything else. Once you start taking medicines, doing meditation, doing therapy, doing yoga, doing journaling, having a pet which can act as an antidepressant, then it can make wonders. But during that time when you're taking medicines, you have to develop more healthy coping mechanisms, wherein, let's say, next time your boss says something to you, what do you do so that you don't get so fearful? Next time you don't get an appraisal in your yearly appraisal meeting, rather than going into a negative spiral, what is the coping mechanism that you can have? So this is taught in therapy. If you do that while the medications are going on, 99% of the patients who have these minor problems can be weaned off medicines, of course under the guidance of a psychiatrist, in generally 6 to 9 months. Second thing is, if you're having a problem, it becomes better. Don't stop the pills. Stop them only when the psychiatrist says so. I'll give another example. Let's say we go to the general physician and he gives us antibiotics for 5 days. We are having a cough and cold. He always tells us that you have to take the antibiotic for 5 days, even if you start feeling better from 2 days, because otherwise you might get a reinfection. Similarly, what people do, what needs to be done here, even if you start feeling better in 2-3 months, take the entire course, so that the chances that you have that again are very, very, very less than. It's like whatever problem was there in your brain, biochemical or whatever it was, with medication and therapy, you have tried to control it to a good level. Another example is, let's say you go to a movie, and let's say in the interval, many movies that we see, they're very predictable. In the interval itself, you know what's going to happen at the end. But do you just go off to your home after the interval because you think that you know what's going to happen at the end? You still stick around. Similarly, even if you start feeling better, do the entire course. Chances are that in majority of the people, it will not be lifelong. Chances are that if you do the course, again you getting the same problem will be very, very, very less. And one more thing is, and I don't know from where this comes, many people who come to us, they say कि doctor साहब liver kidney खराब हो जाएगा ये गोलियों से. Majority of the pills that are available in the market today do not affect your liver, neither do they affect your kidney. So please don't worry about that. What damage a normal antidepressant does, more damage is done by what every Mumbaikar loves so much. A vada pav, a nice oily vada pav, is much more dangerous for your entire body than an antidepressant pill. And it is something that you need. It is something that is required. So rather than thinking about it as a dependence, rather than thinking about it as an addiction, think about it as a part of your meal. So when you sit down to have your meal, what I recommend to my patients is you take your thali, you have your curd, you have your dal, you have your chapati, keep the antidepressant pill in your thali. Have you ever wondered, oh my God, I'm 30 years now. Have I ever wondered, I'm 30 years now. I've been eating food since 30 years. Do I have to take it for the rest of my life? I never think in that way. It is something that your body needs. Similarly, if your mind is broken, it is something that your mind needs.
Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.